for more now on how the CBO will break down the latest version of the health care bill. We're joined by Jim Horney. He served as chief of the CBO's projections unit for 7 years and is now the director of fiscal policy for the Independent Center on Budget and Policy Priorities. Jim, welcome to Bloomberg News. Thank you so much for joining us.
Thank you. I'm glad to be here.
Jim, as you just heard our Lizzie O'Leary report, the initial price tag was $848 billion for this health care reform plan. Public options now out. Medicare buy-in is now out. But the White House insisting that this be deficit neutral and bring down spending. Republicans say that's a fairy tale. Where do you fall on this?
Oh, I think what we'll find is that the Congressional Budget Office will provide an estimate of the bill that the Senate will vote on, possibly before Christmas. And I think what they'll find is that, like the bill the House passed and the legislation that the Senate Finance Committee reported, that first of all, that this legislation will expand health care coverage to tens of millions of Americans who currently don't have insurance and in many cases have inadequate health care, and in all too many instances, because of that inadequate care, have serious health problems.
But Jim, without the public option and now without that Medicare buy-in, doesn't that mean that tens of millions of people are also going to be left out?
No, because the basic thing that these bills do is set up a so-called health care exchange where people who currently don't get insurance through their workplace can buy insurance, but under a set of rules that make it possible to get insurance, where insurers can't turn them down, insurers can't look at their health history, and so on.
What happens if they can't afford it, though?
Then subsidies are provided. And one of the key issues here is what is the level of the subsidies to make sure that people can provide it. But I fully expect that what CBO will find is that 30 million or more of currently uninsured people will get insurance under this, will be affordable, and I think almost certainly they will find that the bill is paid for, that it will not add to the deficit over the next couple of decades, and very importantly, that in the long run, it actually takes the initial steps, the absolute crucial steps, to try to bring the increases in healthcare cost, long-run increases, under control.
Jim, there's been some concerns expressed that any healthcare reform legislation is just going to end up dumping more of the costs on the states. Is that what you're hearing? And if that's in fact the case, how much?
No, I think that they're really trying to deal with that. There is an expansion of Medicaid to cover some of the people who are currently uninsured who have very low incomes, but the federal government's going to help to cover the cost of that. And so I think the states are not going to be unduly burdened by this legislation. And in many ways, I think the states are going to be helped, because right now, states to a very large extent bear the burden of the care that uninsured people do get when they show up at emergency rooms, when they show up at free clinics, and so on.
Jim, talking about the state costs, that seems to be one thing that Democratic and Republican governors have expressed concerns. Have they been advocating for any changes in the legislation as it stands now?
I think all along they have been very concerned, and rightly so, to make sure that the bill is designed in a way that they're not unduly burdened. I think right now that the consensus is that, in general, this legislation that the Senate will vote on will not overly burden states and should not be voted down on that basis.
Jim, we've been hearing reports, the president is threatening to bypass Republicans on health care reform. There's also been some talk, as quiet as it's tried to be kept, about a political action called reconciliation. Is that something that is on the table? And if that does happen, is that a no-win situation? It's not a tactic that's used that much.
Well, in fact, reconciliation is used a lot. It's been used numerous times over the last 2 decades. But I don't think it's very likely to be used in this case. A decision was made earlier this year not to go the reconciliation route, which does offer the opportunity in the Senate for passing a bill with 51 votes, because you can't filibuster a reconciliation bill. But the Congress decided not to go that route. That's why it's taken this long. It's why we've had the bill on the Senate floor now for several weeks,
right,
why there are so many amendments, and why it's dragging out.
Yeah.
But I think the expectation is that the Democrats will get the 60 votes that are needed to get a cloture and stop the debate and bring this to a vote.
And Jim, in about 10 seconds, when does health care reform get done?
Well, I think there's a good chance that the Senate will pass a bill before Christmas or right after. Then they have to work out the differences with the House.
Yeah.
I would think by the end of January, there's a good chance there'll be a health care bill.
Jim Horney of the Center on Budget and Policy Priorities joining us from our bureau in Washington. Thanks.